mighty answer our prayers. We know that we are here today for the breast and cervical cancer awareness and screening program. Taking you through the program guide. Screening starts early in the morning today, and then that is ongoing as we speak. We have the opening prayers. Now may I welcome the CMB, Deputy CMB of the hospital, for the welcoming remarks. Dr. Cherno S. Jallo. Thank you.
Inviting God in our midst to help and support our cancer patients, I first want to recognize the presence of our National Cancer Program, the manager, Dr. Bojang, our board chair, the Cuban and then the Chinese mission, very big dignitaries, our distinguished guests, ladies and gentlemen, our very capable, able, and energetic Edward Francis Small Teaching Hospital staff. But the head of the ones that are coordinating these activities, before going further, I want to recognize them, the head of Department of Surgery and then the head of Department of Obstetrics and Gynecology, who is also doubling down as the CMAC. I would want to say welcome to this August program. And then we are not forgetting the police band and then our media fraternity. This is a very important event for Edward Francis Small Teaching Hospital. We don't take it lightly. This is an event we always celebrate annually to recognize and celebrate our cancer patients, most importantly, breast and cervical cancer, also to send information out to the public as a teaching hospital, what the whole cancer thing is about, and also very important to take stock as a teaching hospital, how far we have gone with our cancer management in this hospital. I want to tell everybody that Edward Francis Small Teaching Hospital as the premier and then the main referral hospital in this country that is tasked to turn around all the health management activities in this country, and then also to build capacity, to also look into research to see how best to work out certain strategies to mitigate some of our clinical challenges. I would want to inform you that Edward Francis Small Teaching Hospital has been doing a lot of things as far as cancer management is concerned. Don't be scared, our distinguished guests. This is a sound you'll always be hearing in this as far as you are within our premises. It's a normal sound you'll be hearing. Don't be panicked. So as a teaching hospital, we are not left behind in cancer management. I want to inform you that as far as investigation is concerned, we are doing a lot of efforts to make sure if we are not top-notch, but we do something that is best practices. Our pathology services is up and running, and it's very reliable, and it's something anybody, anywhere you are, you can rely on. In terms of radiology services and laboratory services, is also optimal, and then there are a lot of work in progress. What I can tell you, what we have can support any cancer patients that comes to us. You come to mammogram, we have. You come to cancer screening, cervical cancer management, it's here. From doing surgeries to giving chemotherapy. So maybe one of the rate limiting factor will be radiotherapy. That's why we are very excited when we see the manager of the National Cancer Program in our midst, who is working very hard to bring radiotherapy in our country. So with that, I think cancer management in this hospital or in this country by extension would be complete. We should all be excited in that a lot of things have been turned around to support cancer patients. Breast cancer in this hospital, it's not only days like today that we see them in the form of screening and also cervical cancer. This is a routine management that takes place in our hospital. We observe what is called Pink October to also add our voice and also take stock, as I've said earlier, of what we do. Without much ado, now that the sun is very hot, I would want to tell everybody that you are welcome to our hospital. You can move around to see what we have. And let us kindly remember, cancer management is very expensive. Chemotherapy is very, very expensive. And the strategies that we are putting in place are very expensive. Governments can't do it alone. We need every Tom, Dick, and Harry to come, all hands on deck to support in that drive. Right now, we are working on getting oncology center for children called daycare. We are working on getting a ward on the adult side to support our cancer treatment. We are working also on coming up with tangible protocols to support us. We all know without chemotherapy, it's very difficult to manage your cancer. From neoadjuvant to adjuvant, you need the chemo. So we call in anybody who can to support in that drive. As a hospital, we want to say before I conclude, we are committed to work with National Cancer Control Program. On the side of government, we are ready to work with all agencies, UN agencies, and any person or any group that points itself to support cancer management. We rest assured the teaching hospital will never be left behind in this drive. And once again, welcome all of you to Edward Francis Small Teaching Hospital. Thank you.
My boss has alluded earlier that the sun is hot. So let me stand on existing protocols to recognize all the distinguished personalities here. This is an annual event that we normally organize every year in partnership with the various bodies, as you can see in the banner, as well as our benevolent sponsors. Now, the importance of this, we all know in the Gambia, cancer is on the rise. And not only that, but also we have seen a surge of a rise in young people being diagnosed of breast, cervical, and other cancers. And these are cancers that we can treat and cure if we diagnose them early. And that is one of the reasons which makes this activity very important. And we encourage all the people to be coming to receive these free services. These services that we are conducting, although free, but at the end of the day, somebody is bearing the cost of these services, because the screening will be done free and volunteers, all the doctors, the nurses here would be volunteering to do the screening. And not only them, the support staff are on the ground behind the scene, making everything, putting everything in place so that the screening can be successful. So this screening that you are seeing, which is done free of service, if you're going to go to any facility to get screened on any time that you want and get laboratory services, radiological services, and pathology, histology services to be rendered to you, you would have to cough out some money. But today, there would be free screening services, there would be free radiological services like ultrasound scan, mammogram. We all know the cost of mammogram. And then at the pathology also, there will be free services. Any biopsies which are done, and then this, well, for the cervical cancer also, there will be both screening for HPV, which will be done free of services, and then we'll also do pap smear and others. All these will be conducted free. The hospital also is bearing part of the brunt of the cost of these free services. So we encourage people to be coming on board. Those who are not able to come today, they can come tomorrow. This is a 2-day free screening for breast and cervical cancer. And we thank you all on that behalf.
Thank you very much. Cheers.
Awareness and screening exercise at the Edward Francis Small Teaching Hospital. I would like to say that this is a very special and auspicious day for us as a hospital, because this is a day where we join the rest of the world in commemorating breast cancer. And not just breast cancer, but also cervical cancer, because these are the #1 and #2 cancers in this country. We're dedicating this month and these 2 days to recognize the struggles that our women go through in order to be able to get care. So as the Deputy HOD, Dr. Sanyang, mentioned, this is a day that Gambian women, and must I say men as well, because it's not a fight just for women, can try and take advantage of this day to get screened and know their status. This is a day wherein they would not have to pay or contribute anything to get this test done. We were here last year, and between last year and this year, according to statistical projections, over 1,200 women in the Gambia have been diagnosed with breast cancer. That's not a small number if you look at the ones that already have breast cancer. According to our records here at Edward Francis Small Teaching Hospital, our breast clinic, when we looked at the statistics in 2021, about 70% of our women came at what was considered a late stage. Currently, those numbers are going down because of the screening efforts that are being done within this hospital and within the country. And we must applaud all those who have contributed to making this type of story a reality. Just before the start of this opening ceremony, I met a staff member who brought their family member. And they told me that they wanted that sister of theirs to get screened. And I told them the screening has started, they can join the queue. He showed me that the patient had already been seen at our hospital here, but their appointment for ultrasound was going to be in a month's time. And obviously, seeing the capacity of Edward Francis Small Teaching Hospital and the other competing healthcare priorities we have here, whether it's malaria or TB that we're treating, or other chronic conditions like hypertension, diabetes, other surgical conditions, you can understand why we would have such long appointments. And that just re-echoes the importance of this day, of getting checked. Because today, it's not just free, but you can have all that done. You can get a clinical breast examination with the full attention of all the doctors. You can get an ultrasound or a mammogram done, and I would like to thank the administration for making sure that this was a reality, along with the radiology department. You can also get your histopathology done within the same day. And I think that is a very, very remarkable feat. We have screenings in other countries, but I think it's only in the Gambia that we're able to get screening for all three on the same day. I would like to commend the administration for that. I would like to recognize all the staff within the hospital in the different departments for making this day a reality. We see these beautiful decorations, these beautiful banners, t-shirts, But obviously, this is the end product of months of hard work, of meeting, of sleepless nights. I would like to say some of the members of this organizing committee barely slept 2 or 3 hours between yesterday and today. And I think it's important that we give recognition to those who've actually pushed. All members within this hospital have contributed. But I would like to especially give tribute to the heads or the people leading this charge. And I would start off by recognizing Dr. Sanyang, who has been the lead on this. Dr. Sanyang, can you please rise? He spent sleepless nights just to make sure. And if you don't believe me, just go to the page. If you take out Dr. Sanyang's messages, there's nothing left on the page. So that just shows how much he's been dedicated to this. I would like to recognize also our senior consultant in the person of Dr. Roberts, who's also been very dynamic in making sure that this day sees this reality. Dr. Jite, who used to be in the department and is no more. We're trying to get her to surgery, but apparently, I think family medicine is trying to take her away. She's also been very dynamic. And I think with her organization, B Nation, they were actually amongst the first groups to help make this a reality. Dr. Jenaba Jallo, I'm not sure whether she's with us today, but also has been very instrumental in making sure that we start screening here at Edward Francis Small Teaching Hospital. You have people like Fatima Kakbo, Sona, Marena, and so many others. And I hope I'll be forgiven for not being able to mention everybody. But this is just to say that this is a group effort. It's not an individual one, and we've all contributed our parts. And today we are here thanks to their efforts and the efforts of everyone else. So again, I would like to welcome all of us to this auspicious occasion. And I hope that we would have many more of these in the future where we will be able to screen more women and have much more impact. I thank you.
Thank you very much. Tireless effort to make this day a reality. The Pink October is a very important month in a year. It's a day set aside to commemorate breast cancer awareness. But the Gambia has gone further to combine breast and cervical cancer awareness. And the importance of that is if a woman leaves her house today and come to Banjul, she can get both breast and cervical cancer screening in one day. She doesn't have to go and come back. Why is awareness and screening important? Because the clinicians will tell me that it is very expensive to treat advanced breast and cervical cancer, if possible at all. Because as earlier speakers mentioned, we don't have the full complement of treatment for both breast and cervical cancer. We can do surgery, we can do chemotherapy, but radiotherapy is not available here. And all the formidable clinicians would not want their patients to go through to get to the level where they may need radiotherapy. So the importance of this day is to inform our audience that screening for breast and cervical cancer is the best weapon for preventing advanced cases of breast and cervical cancer. This day, a lot of effort has been done to make a free screening for breast and cervical cancer. But obstetrics and gynecology departments do screening 5 days a week, between Monday and Friday and every day. So if we go back home, let's inform our wives, our mothers, and our sisters who are sexually active, that is, they are married, and are above the ages of 25 years, that every day in a year, between Monday to Friday, except public public holidays, they can come to Gynae Clinic and get cervical cancer screening. And the good thing is we have the best screening method, that is human papillomavirus screening. For the last 12 months, there has been almost 950 cervical cancer screening, of which we had 160 colposcopy and biopsy. And out of that, we had 46 patients came out to have early stages of cervical cancer. And luckily, these patients were caught early and they got the minimal intervention, which is very cost effective. So if we go back home, please let's disseminate this information to our wives, our sisters, and our mothers, so that they can make use of this opportunity. As we have many speakers, I want to say thank you for all the people who come in one way or the other to support this August gathering. Thank you very much.
Thank you very much, Dr. Keita.
We are from the NCCP, that is the National Cancer Control Program. We are the one tasked with making sure that the burden, that is the mortality and the morbidity of cancer, is brought down to bare minimum in the country. And whatever that entails, from prevention right down to rehabilitation, is our task. So I'm going to start on the existing protocol. And I say, once again, it is Pink October. We gather here today, like last year, and year before last, and year before that, to commemorate Breast Cancer Awareness Month, as we all know, commonly known as Pink October, which is observed throughout the world to raise awareness about breast cancer, encourage early detection, and support those who are affected by the disease. We want to commend Surgical Department, Department of OBGYN, Medical Records, Laboratory, who are actually the main organizers of this event. But in essence, we want to commend Efsth and all the sponsors that actually contributed to this event. As we all know, the fight against cancer is no easy feat, and it is beyond Ministry of Health. So we want to recognize all the non-governmental entities, the CSOs, the associations, the groups, and individuals who have been taking part in the commemoration of this month by organizing marches, walks, runs, seminars, and screening events. Breast cancer, as mentioned, is the most common cancer and leading cause of cancer death in the world. The WHO's theme for this year is "Every story is unique, every journey matters." This is to emphasize that breast cancer is more than a medical diagnosis. Behind every diagnosis is a person, a mother, a sister, a daughter, a partner, or a friend, each with a unique human story. Stories of courage, resilience, and hope. And so it is important we create a world where we look beyond the disease and see the person before the patient, approaching or treating each case with compassion, dignity, empathy, and support. Therefore, the stigma surrounding the disease should stop. Having breast cancer is never a choice for any individual. And importantly, no one is beyond contracting the disease. In fact, majority of the breast cancer occurs in women with no specific risk factors, other than them being women and actually increasing age. But like it was mentioned here before, in the Gambia, we are seeing that the number of those who are coming down with breast cancer, actually majority are below 50 years. Some months ago, we had a meeting with the survivors, about 6 of them. The oldest among them was not up to 35 years, and the youngest was 24. So that is to show that no one is beyond contracting the disease. And we realized that some of the concerns they had included stigma. So it's, like I said, it's not a choice and it's not a punishment from God for somebody to come down with breast cancer. So if somebody or your family or person you know has breast cancer, all they need is compassion and not to actually compound their disease by some of the stigmatization. In the Gambia, like I said, breast cancer is the second most prevalent cancer among women, with cervical cancer being number one. This incidence is increasing, especially in young women under 50, like I just mentioned. In 2022, its incidence rate was 15%, with a mortality rate exceeding 50% among the diagnosed patients. Too often, women are diagnosed at advanced stages when the treatment is more complex and expensive and less effective. Fear and stigmatization and misinformation and limited screening opportunities or services continue to hinder early detection and timely care. Notwithstandingly, breast cancer is curable when caught early. So organization or screening events like this will actually give a better chance to those who are caught early, because 97 to 90% of those who are caught early are actually curable. Early detection is important, but it alone is not sufficient. It has to be combined with timely and effective intervention. So as a program, we've actually developed a national breast cancer guideline. So the key strategy in that guideline to have early detection is what we call provider-initiated clinical breast examination. So part of that strategy is women over 20 years attending any health facility should have a clinical breast exam done by manually. All women reporting to reproductive health clinics should receive a provider-initiated clinical breast examination. This will be part of an integrated women cancer care that we are working on together with RAMCA that are responsible for reproductive health, primary health care, because we need to reach the women at in their communities. NACP, that is about AIDS and EPI, who are actually responsible for immunization, because when we talk of cervical cancer, one of the surest ways of prevention is by HPV vaccination. So integrating services for women, such as providing cervical and breast cancer screening in a single visit, or combining cervical cancer with HIV vaccination programs, help ensure that timely diagnosis and treatment enhances access, quality, and efficiency services. Early detection is, like I say, is crucial, but it has to be combined with treatment. And when it comes to those treatment options, at the ministry, we are working hard to make sure there are plans afoot to train cancer specialists. We are also working hard to make sure that the adequate chemotherapy drugs are provided. And of course, there are discussions and plans to provide a radiotherapy center. So in conclusion, let's remember that every cancer case is more than a medical diagnosis. Every story is unique, every journey matters. Together, let's ensure that early diagnosis, quality care, and survival become the reality of every woman, no matter where they are in the country. Thank you.
Francis Teaching Hospital, Mr. Sani. Good morning, everyone. Everybody has stood on the existing protocols, so I will also stand on the existing protocol and welcome you all. I just want to recognize the presence of the Deputy Mayor of Banjul. Mr. Deputy Mayor, sir, you are welcome. So I'm speaking on behalf of the chairman of the board, who is unavoidably absent due to circumstances beyond his control. I want to thank everybody and welcome everyone to this very important occasion. The FSTH is aware of the Pink October And then it has been celebrating this important day for the past 4 years, 3 years, and including this year. And is very proud to be associated with this celebration. We wish to thank the Department of Surgery and OBGY and all those involved in this important commemoration of the Pink October. The EFSTH board is working very closely with the management of the hospital to make sure that all the important, all the necessary tools that are required for the early diagnosis and where possible treatment of this disease is done. And because of that, the EFSTH management is working closely with partners to ensure that our laboratory services are up and running and all the required tests and other protocols are put in place. The radiology department is also being equipped. People who are conversant or are familiar with the department will realize that currently there is a very active work going on to renovate the CT scan room, as we already witnessed the presence of a new 128-slide CT scan all ready to be installed for diagnosis of various diseases, including, of course, cancer and other related diseases. The hospital management is also working closely with partners to ensure that there is a daycare center meant for cancer patients, especially for pediatrics. And also we are calling on other collaborators to work with us to make sure that we have a dedicated ward for cancer, adult cancers that may require sometimes in the hospital for various treatment and other procedures that are required. So we are calling on the Mayor of Banjul and the Mayors of Banjul to look into this, to come and collaborate with the hospital management to make sure that these centers that we intend to institute on the hospital are realized. Mr. Mayor, please send this to the Mayors of Banjul. Tell her that the hospital is in dire need of this thing. I'm sitting with a renowned surgeon and then just been informed that yes, cancer is very, very important and it is very scary. And then he is telling me that yes, cancer kills, but then when diagnosed early or when caught early, it could be curable. So that's why hospital management is making sure that all these tools are put in place to make sure that early diagnosis is enabled. Some cancer drugs, of course, the hospital is also working very closely with the National Cancer Control Program to make sure that all what is required for early diagnosis and management is in place. And then other partners also are being consulted. Pfizer, for example, is helping in the provision of some very important cancer drugs that can be used, for the patient that, are diagnosed early. So, we would also like to encourage all the staff and all the doctors that are working tirelessly to make sure that these early diagnoses are done and all the people that are concerned are also involved. We have been reliably informed that, the board is reliably informed that a lot of screening has been done, and then a lot of women have benefited in the free screening, and we hope this one will continue. Even though there are some hitches in terms of appointments and also the long queues, but I think it's encourageable and it's important that women are encouraged to come forward and have their free cancer screening. So that the free is not just only for today, but even after this month, screening will continue. And then I suppose it's still free. Yeah, that will be confirmed by the HOD surgery and OBGY set. So that said, I wish to thank everyone, our colleagues from Chinese doctors, the Cuban doctors, all present here. We wish to welcome you and thank you all for making this day a success. A special thanks goes to the HOD surgery, Deputy HOD, Sanya, everybody, and HOD and CMAC for making the day very successful. On behalf of all members of the board and the hospital management, we wish to thank you all and welcome you to this important day. And thank you very much.
Thank you very much.
Protocols
On behalf of Her Worship, the Lord Mayoress of Banjul, Rohi Malik Lu, I bring warm greetings from the Banjul City Council and extend our heartfelt appreciation to the Edward Francis Small Teaching Hospital for organizing this important Pink October Breast and Cervical Cancer Awareness and Screening Program. This gathering, we believe, is more than an event. It is a call to action, a reminder that early detection saves lives and that awareness remains one of the most powerful tools in safeguarding the health of our women. At this juncture, allow me to also commend the leadership and management of the Edward Francis Small Teaching Hospital for their tireless commitment to the health and well-being of our people. Your dedication continues to make Efsth not just a national referral hospital, but a true symbol of care, service, and medical excellence in the Gambia. As the City Council, we take immense pride in our partnership with the hospital, a collaboration rooted in our shared vision to build a healthier, stronger, and more informed society. The City Council stands firmly behind this initiative. We believe that women's health is not a luxury, it is a necessity, a right and a foundation for the strength of any society. Her Lordship the Mayoress firmly believes that a healthy woman is the heartbeat of a healthy city. This is why the Council remains steadfast in supporting initiatives like this, promoting awareness, encouraging early screening, and empowering women to take charge of their health and their future. As we commemorate Pink October 2025, let us renew our collective resolve to keep the conversation alive, to reach every corner of our communities, and to ensure that no woman in Banjul or anywhere in the Gambia faces cancer in silence. I thank you all and send you regards from the Lord Mayoress and the City Council. Thank you. Thank you.
Thank you, Mr. Gay.
The consultants, management, and staff of the Edward Francis Small Hospital, the National Cancer Control Program Manager, all other protocols duly and respectfully observed. I bring greetings from the Honorable Minister of Health, who got back home this morning. That's why he couldn't join you. But he's highly interested in this activity, just like everyone at the Ministry of Health. And we are glad that the teaching hospital of the country is taking an initiative like this. Cancer care is one of our top priorities as a ministry. That's why we decided to have a national cancer control program. This program was established to ensure that cancer care is given the attention that it needs in the country. Because people with cancer, their care is very important to us, and we are always ready to support them and give them all the necessary things that we can do as a ministry. Some of the activities and the plans that the ministry has in place to ensure that people with cancer in this country get the attention and care that they need includes, it ranges from capacity building, and we are glad to support the postgraduate medical training program and to have some of our own Gambian doctors being trained in very important areas that would help diagnose and manage cancer patients in this country. And at this juncture, we want to acknowledge one of our very own, Dr. Fatoumata Jabate, who is our first radiologist in the country. We are proud of her. And I mean, we have young Gambian doctors, the likes of Dr. Roberts, Dr. Jallo, Dr. Jaite, who are all taking the lead to ensure that cancer care is, patients with cancer in this country get very good care with good quality. Which is another reason why we are supporting the diagnosis is beyond just imaging or radiology. But pathology is also very important. We need to do some pathological analysis to identify cancers, which is why the ministry is spending in this area. And you'll all be interested to know that recently, our National Public Health Lab got support from one of the international partners of the ministry who bought us some equipment and some reagents to test for cancer tumor markers. So we believe this is a great initiative. And we are also encouraging young Gambians to specialize in cancer care as a specialty of its own. Because we believe that when you suspect cancer in a patient and then you take them to get the investigations done, if the investigation confirms that the patient has cancer, they would need to be taken care of, because you wouldn't want to diagnose someone and just leave them like that. So, which is why the ministry is encouraging young Gambians to specialize in oncology. That's why recently, when partners reach out, key areas or priority areas that we want to get support from, oncology is one of the areas we tell them. And we've also gone very far towards having the first oncology center in this country, because most of the cancer patients that come and the care is not available, it is disheartening that we always receive medical reports with recommendations saying that this patient's cancer is at this stage and the recommendation is to go for overseas treatment. This we know is very, very expensive and it's not sustainable. But when people come, we can't say no to them. So which is why we are encouraging our people to also go and learn and get the requisite knowledge and skills, so that when people have cancer, they would come, they'll stay in the country, get the care that they need. And even we've gone as far as trying to get partners who will support us to ensure that even palliative care for cancer patients is done in this country. We will continue to collaborate and work with the Edward Francis Small Teaching Hospital, because it is our only referral, it is our main referral facility in the country. And if Efsth gets it right, we believe that the ministry will also get it right, and the health sector by extension, and the country will succeed. So we are always available to give all the necessary support to the management and staff of the hospital. Those are open to suggestions that you would think we can work towards ensuring that we succeed. We are aware that we can't do this alone as a hospital or as the government, which is why we recognize and appreciate the support and collaboration of the civil society organizations that are very passionate about cancer. And going forward, we will continue to coordinate activities that are related to cancer care, especially in the month of October. We tried as a sector to ensure that this year we coordinate all activities. We coordinated all activities to ensure that we get a successful event. We can improve on this, and we give our word that we will try as much as possible to avoid simultaneous activities going on, because we believe this is the last point. So if all the other CSOs and groups that are working, doing awareness on Pink October do the other activities, we want the Efsth to be the last point to do their screening and treatment. So we encourage you, and we say again that we are available to always support. Again, I bring greetings from the senior management of the Ministry of Health, and I thank you all for your kind attention.
The Ministry of Health, represented by Dr. Fanmata Diba. To Mr. Gay, the Deputy Mayor of Banjul, to the NCCP under the leadership of Dr. Keba S. Bojang. Your attendance is a testament to your commitment to the healthcare and well-being of our nation. We extend heartfelt thanks to the leadership of the Edward Francis Small Teaching Hospital, to the CMD, Dr. Mustafa Biteng, to the Deputy CMD, Dr. Chandra Jallo, to the Head of Department, Dr. Lamin Jaita, to the Head of Department of Obstetrics and Gynecology, Dr. Abdullah Keta, to Dr. Sanyang, Deputy HOD of Surgery, to the Chairman of the Screening Program, Dr. Charles Roberts. We thank you all for your vision and steadfast commitment which is instrumental to the success of this program. To all staff of the Edward Francis Small Teaching Hospital and the School of Medicine and Allied Health Sciences, we are deeply honored that you attended this year's screening program. This is the fourth. We've done it 4 years in a row with success. And your presence here affirms the shared commitment to breast and cervical cancer care in the Gambia. To the Chinese medical mission, to the Cuban medical mission, to the media houses, to the security officers, to the operations officers, to the atlas, to the records officers, to our incredible volunteers, for your dedication is the heartbeat of this program. Without your service, we wouldn't be able to bring this to fruition. This year, we are proud to align ourselves with the World Health Organization theme, every story is unique and every journey matters. The theme serves as a powerful reminder that behind every diagnosis is a personal journey marked by courage, resilience, and hope. Every woman deserves timely, compassionate, resilience, and equitable care. 4 years in a row, this event has grown stronger thanks to the unwavering support from our partners. To the medical team who have worked tirelessly to screen, educate, and uplift women in the Gambia, your service is invaluable. Thank you to the Edward Francis Small Teaching Hospital through the collaboration between the Department of Surgery, Obstetrics and Gynecology, Laboratory Medicine, Radiology for collaborating to make this a success. We also want to thank NCCP, the Solace Foundation, B-Nation Company Limited, Unigamsa, Trust Bank Gambia Limited, the Chinese medical team, Ecomed, Star Oil, Gambega, AfriMed, Global Properties for sponsoring this program. Special appreciation is extended to the Bajan Group for providing this beautiful decoration free of charge. I would like to pay a heartfelt tribute to the pioneers of this initiative, to the Department of Surgery under the leadership of Dr. Lamin Jaite, to B-Nation Capital Limited, to the former CMD, Dr. Ahmed Jafari, and to Penda Gay. Their collaboration and vision is the reason why we are here today. Also to the current administration for carrying on the baton and the task of making sure that this is a continued success. Most importantly, we want to commend the women for coming because they are the reason why we are doing all this. Your courage and proactive approach to health is a powerful act of self-love and community. Wearing pink today is more than a symbol, it's a statement of solidarity, remembrance, and hope. It honors those that we have lost and uplifts those who continue to fight. Whether you are participating as a guest, as a volunteer, or you just came to be screened, we urge that we all become advocates for early detection and treatment. Your voices can save lives, spreading awareness and hope throughout our communities. As this opening ceremony comes to an end, let us remember that the fight against breast cancer and cervical cancer continues. Together through awareness, action, compassion, we are rewriting the stories for a better nation for all. Thank you all once again. May good health and hope in cancer care in the Gambia continue to prevail. Thank you.